Hello everyone. Welcome to EasyMed. In this video, I'm going to talk about Flecainide. Flecainide is a medication that is classified as a Class 1C antiarrhythmic agent. It is a sodium channel blocker. It is particularly used for the prevention of atrial fibrillation. Flecainide prevents the recurrence of atrial fibrillation, and it has minimal side effects compared with other medications like amiodarone. It is convenient to use and suitable for people with normal ejection fractions without any structural heart disease. This video explores key information about this medication. How does it work? Flecainide is a Class 1C antiarrhythmic agent. This medication blocks the voltage-gated sodium channels. Normally, the sodium channels can exist in the three states. The first one is an active state, where they are open to allow the sodium ions to enter into the cardiac cells. These sodium channels are opened when the membrane is depolarized. Another phase is the inactive state, where they are completely closed and they are ready for another activation cycle. They can be closed when the membrane is going to be repolarized. In between these two states, sodium channels can exist in another state that is called the refractory phase. In the refractory phase, ion channels are open partially, but they do not allow passing sodium ions through them. Therefore, when these ion channels are in the refractory phase, they are not ready for activation. Flecainide can slightly increase this refractory phase, thereby increasing the time for reactivation of sodium channels. This slows the conduction in the people with atrial fibrillation. It reduces the rate of rise of action potential without affecting the total duration. This medication also has a local anesthetic activity. How is this medication given to you? Flecainide is available as a tablet at different strengths such as 50 mg, 100 mg, and 150 mg. It can be used for the prevention of cardiac arrhythmias like atrial fibrillation. For this purpose, it can be given at a dose of 50 mg orally 2 times per day. The steady state can be achieved after 4 days of the treatment. Therefore, any dose increments can be done only after 4 days. The dose can be slowly increased based on the therapeutic response. However, the maximum dose is 300 mg per day. If you're unable to tolerate the dose as 2 individual doses, it can be made into 3 individual doses with a separation of an 8-hour interval between each dosing. After 5 doses of the treatment, an ECG may be obtained to check for any abnormal changes in the ECG. If you are switching from another antiarrhythmic agent to Flecainide, at least 2 to 4 plasma half-lives of the previous medication should elapse before starting Flecainide. If you are initiating use of amiodarone, the dose of Flecainide should be reduced by half. In people with severe renal impairment, the dose of Flecainide may be limited to 100 mg per day. Flecainide has a high bioavailability. Around 85 to 90% of the medication is available in the body. It shows the peak plasma concentrations within 2 to 3 hours. Its therapeutic range is between 0.2 and 1 microgram per ml. What are the precautions to be considered? Flecainide slows your cardiac induction. This may result in few changes in your ECG. Particularly, it can increase the refractory period of sodium channels, which may result in the increase in the PR interval. It can also prolong QRS and QD intervals. Therefore, this medication should be used at the lowest effective dose in order to avoid abnormal change in the ECG. Before using Flecainide, any disturbance in the electrolyte should be corrected. Particularly, the levels of magnesium and potassium should be closely monitored. In the people with hypomagnesemia, low levels of magnesium, or hypokalemia, low levels of potassium, the use of Flecainide may increase the risk. Therefore, before starting the therapy, these levels should be corrected. Flecainide may cause few visual disturbances. It may produce blurred vision and dark spots in our vision. You may have difficulty in focusing with blurring of vision on the side you try to focus. So you should be careful if you develop blurred vision. Flecainide can depress your left ventricular function. This is due to its blocking activity on the voltage-gated sodium channels, reducing the conduction. Therefore, in people with any pre-existing left ventricular dysfunction, this medication may further impair the condition. Flecainide should be avoided in people with heart failure. This medication has a negative inotropic effect. That means it reduces the force of contraction of your heart. It may result in a decrease in the cardiac output in people with heart failure. Similarly, in the people with any structural heart disease, Flecainide is not suitable. Just like many of the antiarrhythmic agents, Flecainide can also have the proarrhythmic effect. It may convert the atrial fibrillation to atrial flutter due to slowing of atrial rate. Therefore, an irregular heart rhythm in atrial fibrillation is transitioned into a more organized rhythm of atrial flutter. This may result in one-to-one AV node conduction. Normally, few impulses are blocked at the AV node to produce a control on ventricular contraction. However, with one-to-one AV conduction, every single atrial impulse is conducted to the ventricles, leading to a very rapid ventricular rate. This can be minimized by the use of beta blockers or drugs like digoxin, which have the negative chronotropic effects. They can control heart rate. Around 10% incidence of ventricular tachycardia or fibrillation may be observed when Flecainide is used for chronic atrial fibrillation. Therefore, it is not recommended for treatment of chronic atrial fibrillation. The proarrhythmic effect of Flecainide can be observed in people with any structural heart disease and in people with postmyocardial infarction. Flecainide may interact with a pacemaker and increase the capture threshold. This may result in the failure of pacemaker activity. Therefore, if you're using non-programmable pacemakers, Flecainide may increase the risk. Now let's see the side effects of this medication. It mainly produces dizziness and visual disturbances. You may also experience palpitations and chest pain. Edema, fatigue, and tremors can also be observed. It can also increase the heart rate, leading to arrhythmia. You may also have double vision, abdominal pain, and loss of appetite. That's all about important information regarding Flecainide. Share your experience and how it works for you in the comment section below. Thanks for watching this video. Have a great day.